Has your dentist recommended that you get a bone graft? Are you confused as to what that means or why it's even recommended? What situations require it? If you have questions about dental bone grafts, this video is for you. My name is Dr. Clarissa Shah. I am a general dentist living in Southern California, and this channel is dedicated to all things dental. In this video, I'm going to be explaining the different indications for bone graft and why your dentist may have recommended it. Now, I do want to put a disclaimer out here. I am a dentist and I am qualified to give dental advice, but each case is different. Every patient is different, right? Things go on a case-by-case basis. So use this video as background knowledge to aid you in making your decision so that you can make the best informed decision about your health. But you still have to refer back to your primary dentist who is overseeing your case and treating you and knows all of the facts regarding your medical history and the health of your teeth and bones and gums. So let's get right into it. So what is a bone graft? Well, bone graft is material that we use to help build more bone in an area of your body. We're talking about dental bone graft, so one of the main times that we use a bone graft is during a tooth extraction, when you have a tooth taken out. Now, when you have a tooth taken out, there's literally a hole in your bone, and oftentimes it's recommended to get this bone graft material and fill up that hole. The bone graft material is going to fill up that void and cause your body to build its own bone in the area. It's going to stimulate bone production, and it's going to allow your body to heal with a nice thick bone in that area. If you don't put bone graft in that area, your body will still heal itself, but it's not going to heal strong and dense. And a lot of times, the bone can have a lot of imperfections after that really limit you in the future. Let me explain a little bit about that. So as I mentioned before, the most common time that a bone graft is recommended is during a dental tooth extraction. You also have to think to yourself, how am I going to replace this tooth that I'm missing? The options for replacement include a dental implant, a bridge, and a denture. A dental implant is a screw that's attached into the bone. It's fixed into the bone, and we put a little fake tooth on top of it that looks very natural from the outside, but clearly is not alive. It is a synthetic or prosthetic tooth. Now, you can imagine that if a screw is being held in by the bone, you want that bone to be really nice and thick. Otherwise, the screw is going to get loose on you, and that's what's called implant failure. So if you'd like to consider a dental implant, if you want to be a candidate for that, it is absolutely crucial that you do have that bone graft placed in the extraction site at the time of tooth removal. Bone graft can only be placed in the hole during the time of the extraction. In some very rare cases, if you have a huge infection, maybe they'll elect to place it a couple days after, but it's not something that you can do a month or two after. You will already have healed too much. You need to have that fresh hole. Your bone needs to be open. There has to be blood in the area because the bone graft mixes with the blood, and that's what signals your body to build bone in that area. So it has to be a fresh wound around the time of your tooth extraction. Bone graft is mainly used so that your body produces nice thick bone in the area the way it was before. Conceptually, when you think of an implant, I want you to think of a screw and screwing that screw into sawdust or like IKEA material type furniture versus screwing that screw into a solid piece of wood or a stud. Whenever we hang TVs in our house, you want to hang it on the stud because the stud is a lot stronger than drywall. It's the same concept with bone graft. If you don't have a bone graft in the area, your bone is not very dense. It heals up just enough to close up the space, so you don't get dense bone back in that area. And in addition to that, your bone shrinks, so it gets really skinny. And implants need a minimum thickness and width of bone in order to be placed. Otherwise, you're gonna have an implant coming out the other side of your bone. It's gotta be thick enough, a thick enough block of bone to fit the implant safely. That brings us to our next point. What if you're not a candidate for an implant? Or what if you say you never want an implant to begin with? It freaks you out, you don't want any screws in your bone, that's just weird. Well, another option for tooth replacement is a bridge, and it is still recommended to have a bone graft placed during the time of the extraction for aesthetics. So like I mentioned, if you don't place a bone graft, your bone does heal, but it can heal with a big concavity, meaning the bone gets smaller and thinner in that area. That leads to what's known as a knife edge ridge, which means that area of your bone's really skinny. And if you're losing a tooth in the front, guess what? You're gonna have an indentation right there. You're gonna be able to see it, you're gonna be able to feel it. It's not gonna look natural. And once that bone is healed, there's nothing we can do to fix it. I can't go in there and make your bone wider. There are some very special cases and techniques, which I just have to mention because I know someone out there is gonna say like, yes, you can, but I'm talking about like if you're gonna get a bridge, there's no reason you would ever do a bone expansion surgery, put yourself through all that pain, very costly. You might as well just get the bone graft at the time of the extraction, save yourself all of that trouble, or you'll have to live with that concavity in the area. Again, I'm just mentioning the main general points of bone graft. For everything medical, there can be an exception, there can be a way around, but for the purposes of this video, I'm really just gonna cover the main things. And if you guys want a specialty video, we can, go into that later. You can request in the comments and I'll see what I can do. The last reason that a bone graft is recommended in the area is to maintain the bone support of the neighboring teeth. So when you remove a tooth, that bone that was holding the tooth in place is going to shrink, it's going to get weaker, it's going to get lower. What happens is the teeth on either side lose some of that bone support. Where the bone used to be really nice and thick and strong right here, now it's not. And so this tooth has half of the amount of bone support that it used to have originally. Now, there are a lot of dentists that don't place bone graft. It is a more modern technique. So if you have dentists out there who are, in their 60s and 70s still practicing, they may not place bone graft or recommend bone graft during the time of their extraction just because that's not the way that they were trained. And unfortunately, because of that, I have seen so many patients with work that's been done previously at another office and extractions that have been done at another office. They come in and I just look at their x-rays and I can see where their bone is weaker in that area. And now those two teeth are holding up a bridge. Or now they want to know if they can get an implant placed and their bone is so skinny. So in my professional opinion, I would always recommend a bone graft at the time of the extraction. That's what I would recommend to my mom. That's what I would want done on myself and my family. It's just gonna give you more options. It's gonna protect the neighboring teeth, and it's gonna keep everything looking so much more aesthetic. An exception to the bone graft rule when you're talking about extractions is wisdom teeth. Usually for wisdom teeth, we do not recommend a bone graft because it's really not necessary. However, there are some instances where maybe the wisdom tooth is coming out sideways, and when we take it out, that causes a huge loss of bone for the second molar. That's the tooth that's right in front of it. So in certain special cases like that, we will recommend placing a bone graft in that area just to see how much bone your body can recoup during the time of healing and to protect that tooth in front from ever becoming loose. But like I mentioned, it's really a case-by-case basis. Your dentist will go over everything with you. They'll review your x-rays and your medical history and your treatment plan, and they will give you their best recommendations. But just in general, bone graft for wisdom teeth is definitely a little bit more rare than it is for bone graft with extraction of any other tooth. Another thing I wanted to mention as well is we usually don't put bone graft for extractions that we do for orthodontics. So when we send you to get braces, sometimes if there's not enough space to move your teeth into the position that the orthodontist wants them moved to, he or she will recommend removal of some of your teeth, your permanent teeth, to make that space. At that time, usually patients are so young, their healing is really good, and the teeth are going to continue shifting, so there's going to be continual remodeling of that bone. So bone graft is usually not recommended. Once again, there can be special cases, like if the patient is suffering from gum disease, if they're a little bit older and there's already a huge loss of bone, maybe they will recommend bone graft at that time. But generally for kids, we don't really recommend bone graft. We also wouldn't recommend bone graft if we're taking out a baby tooth that's maybe stuck or left behind or coming out in a different direction. For adolescents, we usually don't recommend the bone graft. And lastly, I want to talk to you about a scenario that's a little bit less common. And lastly, I want to talk to you about a gum procedure that often uses bone graft. When a patient has active gum disease and they've lost a lot of bone, there's really no way to grow the bone back in height, but we can do some procedures to try to make the bone that you have a little bit stronger. There is a procedure called osteosurgery where we kind of pull your gums down a little bit and we clean up everything that we see in that area. We can put some PRP in the area, and we also mix that with bone graft, pack it in, and hope that your bone gets strong and regenerates. That type of bone graft procedure will usually be done by a periodontist, which is a gum specialist. And if you guys want more information on that, once again, just feel free to leave me a comment down below. So next I'm going to show you some patient x-rays, and I'm going to explain to you what we're looking at and what it looks like when the bone heals with bone graft and without bone graft. I'll show you examples of some of my own patients who had extractions and work done previously before coming to me and unfortunately did not have that bone graft procedure done. You can very clearly see where the bone is a lot weaker in the area. Okay, so I'm going to begin by showing you some photos, and then I'm going to show you what it looks like on the x-rays. So take a look at these two images. When you have a tooth removed, this is what your bone will look like. Now, the image on the left is a situation where a bone graft was not used. And like I mentioned before in the video, when your bone doesn't have that stimulation, it heals really skinny. So how are we going to place an implant right there? There's no way. The implant is going to come out the other end. Whereas when you take a look at the right side, there was a bone graft placed there, and so now we have a nice healthy amount of bone to fit an implant that's going to last a really long time. I want you guys to remember that the teeth are what keep the bone there. Without the tooth, without anything there, there's no reason for your body to put bone there. So the body's not going to invest any more energy into doing that. I'm going to show you what that looks like in the front here. We can see this is an image of a tooth in the front that was extracted. Do you remember I told you that if you don't place the bone graft, your bone can heal with a concavity? Look at that. So when they smile, you can see this. Instead, they should have had a little bit of bone graft placed, and now look at this. The bone is nice and thick on both sides. If you wanted to have an implant placed right here, you could. And if not, if you wanted to just go with the bridge right here, you could do that as well. But when you smile, when you look at the person, head on when they're smiling, you will not be able to see that anything is going on right here. Next, we're going to talk about some x-rays. So before we get into this, I just want to show you a general rundown of what we're looking at here when we're looking at x-rays. So this is called the crown of the tooth. This is the part that sticks up above the gums. This is the root of the tooth, and all around it, the spongy is the bone, and that's what holds the root in place and gives your tooth its stability, its support. So when you have a tooth removed, extracted, you have that opportunity of placing the bone graft here in this area. And when it's not placed, we can see on the x-ray when the bone does not heal as thickly. So take a look up here. You see how there's an area of more white. So the whiter something appears on the x-ray, that means it's thicker. That means the x-ray doesn't pass through that area. When you see something that's black on the x-ray, that means it's not very thick and the x-ray passes all the way through. That's how we can distinguish different types of materials. That's how we can distinguish what part of the tooth has a cavity and what part doesn't, because the cavity will show up all black because that part of the tooth is totally rotten and the x-rays pass through it super easy. So now let me show you some other x-rays right here. All examples of my patients that had extractions and didn't have the bone graft placed. So take a look at this. Do you see how it's super, super dark here in this area? You can see where the bone graft wasn't placed, where the tooth was missing. Now, the issue with that is that not only is this bone here not thick, it is losing bone support on either side of these teeth. So now this tooth is supporting a bridge and this tooth is supporting the bridge, but these teeth are a lot weaker because they don't have the full amount of bone. Ideally, the bone would come up to this level on both sides. So that's a lot of bone that's missing. Remember, we're talking in millimeters here. Your teeth are not very big. So even though it doesn't look super big on the x-ray, that's a lot of space. Same thing coming on next. Look at here. You can totally see where the tooth was extracted and no bone was placed. So the bone did not heal very well. And over here as well. Look at that. There's barely a tiny, tiny skinny piece of bone right there. But the majority of this is very thin. Now this next image is going to shock you guys. Seriously, when I saw this, I was so shook. So this right here, the image to the left, happened in September. Technically, they're both from September, but this patient came in and they had a really big infection on this tooth right here. We couldn't save it. This whole black hole, remember I told you the tooth is rotten? It was rotten into the bone. So we couldn't save this tooth. Whoever did it, the extraction at the time, they couldn't save it. We had to remove it. So they extracted this tooth and look at what happened. All of that bone totally missing. This poor little tooth right here only has half of the bone support. I would not be surprised if this tooth is loose, because there is no way you lose half of the amount of bone support and the tooth is going to stay solid, much less if then you want to try to put a bridge on this tooth. So this exact reason, this scenario is why I always stress to my patients that they absolutely should get that bone graft. You don't want to risk this. You don't want to risk it. More likely than not, this tooth is not going to last this patient the rest of their life. It's going to become loose and it's going to save yourself that headache and fill this area up with the bone graft, and your teeth are happy, you're happy, and we're happy. Thank you guys so much for watching. I hope I was able to answer your questions with regards to what a bone graft is and when it's recommended. If you guys have any other dental questions, feel free to leave me a comment below. I am going to be posting so much good stuff on this channel, and I am always open to suggestions or making a video to answer some of the questions that you guys have. If you enjoyed this video, please hit that like and subscribe button. Again, my name is Dr. Clarissa Shah. I'm a general dentist living in Southern California. And feel free to check out my Women's Lifestyle YouTube channel. I cover a range of topics from fashion to home decor to food and health and wellness. I'm always open for you to stop by and say hi. All of my socials, websites, and link to my dental office will be linked in the description box below. Thank you guys again so much, and I'll see you soon.